My pronouns are she, her. I work as a therapist with the mood space. And I just wanted to take a minute to really acknowledge all the conversations we've had today. As someone who's coming in for a national convening for the first time, I was definitely very, very intimidated as to what experiences I'll be taking away. But to hear each and everyone here speak today and to have covered so much today, I just want to say, as someone who's still making her mark in this field as a fairly early career therapist, I think I know I am someone who really needed to hear all the conversations that were happening today. And yeah, just a big, big, big thank you to everyone to have given us their expertise, something I don't think in 10 years I could have, really gotten the knowledge that I did today. So I hope we can just give a round of applause for everyone, all of us who showed up as well. Thank you.
Just overall looking at how IMHA has been vocal and talking about so many in the Homecoming, the book, hearing from each and every author. Every story I think was so heartwarming. Dr. Shelja, thank you so much for sharing the period kit. I think everything has been extremely inspiring. I think seeing so many mental health practitioners, collaborators, and people coming from different walks of life coming together and celebrating mental health, talking about it, being vocal, and really inspiring all of us. So I think it's a beautiful, beautiful day. Thank you so much for. I can only imagine the amount of effort it would have taken. Even the booklet. I think seeing so many organizations come together. I mean, just knowing that all over India there's so many people working and talking about mental health and tirelessly working. So it's lovely. Thank you so much.
My name is Saraswati Suresh, and I'm from FabMe, Mumbai. I'm also the Western zone of Face Me India, which is founded by Dr. Nirmala Srivasan. Um, we are at the space of advocacy and empowerment of families. When we say families, we also include loved ones. And it was an amazing experience getting so many people into one single room after so many years. And you're all talking the language of mental health. I think that itself is a very, very big chapter, uh, especially for families like us who are going through this journey day in and out. And with, like how Rohini said, hope is our religion. You know, today there is another hope. And I'm really looking forward for more funding and collaboration to families like us to take forward the challenges that we face today. If you can support us, I think it will be a very, very, very big thing for us. Thank you so much. Thank you.
In Delhi and NCR. The name of our group is Shanti Delhi, and we are more than 100 families in our group who each have a mental person in their families. So, very beautifully organized program, and I'm sure if this can be so perfect, we can achieve our goals not in 20 years, as Sir said, Ashish sir. We will be doing very quickly the way things are happening here, and so thankful for all this arrangement.
I think there's one thought that keeps coming to my mind, which is it's a very famous book and a quote which says, love is letting go of fear. A lot of our work, yeah, based on attitudinal healing and psychology, and I think in every session, so whether it's from parents who are living with children who are neurodivergent or going through a difficult time, to now, all of us who are trying to move the table. I think someone said move the table. I think it was Dr. Amit, from the middle, from power to really get that connect with maybe, government officials, teachers. I think that one sentence just resonates with me so much, because I think all this work on mental health is it's a work of love. And I think if we can let go of all our fears, I think we would be a stronger community. So thank you so much, everyone.
Congratulations to all of us being part of this first national convene, and many more to go. I will, more from the day or session point of view, I will speak from personal point of view as a closing remark. I come from a background where I was handling the typical medico-clinical projects related to maternal child health, reproductive child health. And right now also there are projects which are completely focusing on curative care. And each of the project is doing like 60, 70 OPDs on the ground on everyday basis. Very new sector for me. I like to admit this. This is my first ever any conference focusing on mental health issues. And I think I am blessed to be here. It is the first step. Lot of knowledge need to retrospect, needs to introspect what can be gained and what, when I'm coming from that medical point of view and the communities coming to those OPDs, what here can be taken over there and what, where the both things can get, marry each other and can work together. So thank you so much for giving me this exposure, and I'm looking forward to many more. Thank you.
So I'm Pavel. I'm from the Chinky Homo project. Before I have 3 points to make. I want to add on to my friend Suraj here, where they talked about geography and all. And in my experience of working across the country and also in I also like building collaborations among regions, be it north and south or being north and northeast or south and northeast. One thing that I've come across was about how the values that we follow in our own sector differs context to context, as Suresh was rightly pointing out. So I feel like another thing that we can do as a convening as such is to also bring that forth. What freedom means to a Meitei could mean different to what could also, I mean, what freedom means to a Meitei or what freedom means to a Malayali person, or, or when we talk about a caste and class and all those divided ethnic, all of that. Something like that I would like to, and also like in terms of the ideology as well, right? Like how are we adhering to the values that we have sort of identified for us? How do we relate to it? How does it interpret to our lives and all? The second point being, one to us, I really like that session by Raj Mariwala, and also to take out climate from that context of how we see it to another, like just to kind of like bring it up, like that's what we do, queer and trans people, bringing things out of the box. So one of the initiative that is there in Moirang, in Imphal, in Manipur, is Mahai Center, which is a livelihood and skill building center. It basically, when we think about livelihood and skill building, we're always thinking about efficiency and production.
In mental health, we started with individuals, then groups, then now we believe community has to be integrated. Similarly, in our work also, we started as an individual organization level intervention, then group of organization. I think this is the first time now the community of organizations have come into the place. I believe that this will be the way forward. Thank you.
Hi, I'm Shivani, and I represent an organization called Seeker, which actually works on mental health from the Indic perspective. So the solutions, the education is all 100% Indian. And more than talking about what we do, I just want to say that IMHA is a trailblazer. The fact that in an industry which is not yet really established, to already create an alliance, to know that we will be able to, the force of the collective will be able to catapult and speed up many, many things, and collective wisdom will actually prevent all the learning, pitfalls that happen. And so the biggest congratulations, so inspired by this convening. Thank you.
In Tamil Nadu, many people also came here, but in Tamil Nadu, 400 kilometers in Theni district, border of our India map. So this is a great opportunity for me. The same manner, the mental health also, I started work as a caretaker. I joined as a caretaker because all the collaborative organizations here. I joined as a caretaker in MS Chelamuthu Trust. Nandri ma'am is representing the MS Chelamuthu Trust here. Then I joined as a social worker in SCARF India, Schizophrenia Research Foundation. Now I am collaborating with Banyan and the Liberal Love Foundation and Mariwala Health Initiative. Next, we are going to do some stall in Manautsava in Rohini Nilkani Foundation. In that manner, from bottom to top, we are growing up. So this is a great opportunity for providing us, because we don't have that financial support. They gave us financial support also for participating in this IMS. In that manner, here, because I know because I am starting from caretaker, so always I am, because most of them we are like in the hero in the cinemas heroic, we are looking as our hero. But myself, I looking as an organization. Today, whenever I am having timing, I see all the social medias of bio organization like India Mental Health Alliance, Mariwala Health Institute, Rohini Garni, what are the opportunities they are giving, what are the programs they are doing. That manner, I always search. Most of the people I saw in the social media, LinkedIn and Facebook, some other. So here I am seeing this opportunity to see most of the people in the directly, the great opportunity for me.
And Vandana from Basic Needs India. I really want to say a very big thank you. I heard about IMHA for the first time when the information came about, this alliance convening, and I'm so lucky that I'm attending this by default. Somebody else was supposed to come from Basic Needs, so I was here. And I'm so it's so heartwarming to see that mental health sector has made it so inclusive. Sign language was there. We are learning from LGBTQ people how to in our introduction how to bring that aspect, and how Raj Mariwala talked about for visually impaired. And I'm so impressed because, generally, even in the disability sector, we don't see this much of an inclusive approach in, conferences or such alliance meetings. So that's really, really heartening. And this has been so well organized, right from the kind of information came to us, documents came to us, and today, very well organized.
We've been doing this work for over 50 years, nearly 50 years now. I know Neha explained very nicely the whole concept behind IMHA's logo. And I'm going to tell you, Neha, that I would have preferred if it was AHA. Because I think in this entire day today, from the morning that we started, I would turn to my colleague Shivani with so many aha moments. I think it's been a privilege, really a privilege to sit here and listen to all those stories. I've been working here in this space for over 20 years, and one can begin to get burnt out and jaded. But having heard the stories that one heard today, it renews my hope. It's literally been a hope-building day today. And especially when we come from the context of the world that we are living in right now, where you read the papers and you hear all those stories, and when you come here, you say, okay, my hope in humanity is still intact. So that's what I'm taking back today. And I think the last thing I want to say is that we have all been working in our own little spaces, with our own little set of people, working in isolation at times. Today, I feel like I'm a part of a fraternity.
This alliance is going to be just so great if we can keep up the momentum. And maybe we could even start some regional chapters with you all guiding us, because like in the Northeast, if I see people from so many different states here, and if we want to go forward and work through certain things and all, it's sometimes easier for us to meet there. And if we call some of you to come and organize things for us and all.
Yeah, first of all, 100 out of 100 to IMHA. I am Ujjwal Kele from SA Schizophrenic Awareness Association, Pune. We have one gentleman, his name is Amrut Bakshi, Neha knows. We call him as an encyclopedia of mental health. So he has formed one group called as Mission. So a couple of people, they said that one group should be there who can discuss about their problems and solutions also. So we have 400 members in that. So every day, at least 50 to 100 messages come and go. So like that, you can open also that.
I think it's been an amazing day and very powerful, a lot of powerful dialogues. I think for me, the most crucial takeaway was how we were not talking about mental health in isolation, but we were always saying that, okay, mental health and their intersections and intersectionalities. And we have, I think, used this term like a lot of times today. But I feel that what could be more powerful is really naming those intersectionalities and being very open and clear about it. Like, for example, when we say that, okay, there are structural inequities that really determines our mental health, let's talk about those structural inequities. Like, for example, okay, there are caste discriminations, there are class discriminations, gender and sexual discriminations for sure, and that actually like affects our mental health, and that also happens in the social justice space itself. So I think it's very important to talk about that. And the second thing is, I think like we are working for many years. Maybe some of us have just entered the mental health landscape and space, maybe from our lived experiences or years of experiences of working in the social justice space. But I think for an alliance like IMHA, it is so important to really crack this, that for young organizations, how do we enable spaces for young organizations to speak up? To also, like, maybe we haven't created impact according in terms of numbers or reaching out to a lot of communities, but how an alliance like IMHA can visibilize these young organizations who are doing great work in the grassroots. So yeah, these are these two.
Thank you so much for that.